Welcome back. This is part 71 of things that your vet staff wishes you knew, and for this video we're going to cover what to prioritize on a budget. It's no secret that vet care can get very expensive very fast, and I don't want you to feel guilty for not being able to afford all of that at once. So we're going to talk about what you should prioritize and some of the nuance to it, and just know that the most important thing is that it does eventually get done. Not that it's done all at once, but that it's done eventually. And I'm also going to preface that this is partially my opinion, and this is how I go through this with owners in the rooms when they are concerned about cost. I would say the number one thing to prioritize is the rabies vaccine, partly because it is usually a legal requirement in many states, and partially because it is zoonotic. And being zoonotic means that your pet can infect you. Rabies has a long latency period, but once the symptoms are there, it is too late. It is almost always a death sentence. After rabies, the next thing to prioritize would be the core vaccines. For cats, that would be FVRCP, and for dogs, that would be the DHPP and the leptospirosis vaccines. Because I'm limited on time, I'm not going to go into too much detail on vaccines for this video, but I have done previous videos on vaccines and why they're so important. So for dog vaccines, that was parts 2 through 7, and for cat vaccines, that was parts 23 and 24. After core vaccines, the next things I would prioritize would be flea, tick, and heartworm prevention, as well as your yearly heartworm test. Fleas, ticks, and mosquitoes are everywhere, and even your indoor pet is not immune. They can still get inside, whether it's on you and your clothing, or if they slip in other ways. I did previous videos on fleas, ticks, and heartworms back in parts 26 through 28, if you want to go back to watch that for more detail on why they're able to cause so many problems. The next thing I would prioritize would probably be lifestyle vaccines. For cats, that would be FELV, and if your cat goes outside, they should probably be getting this vaccine. And for dogs, that would be Lyme, Bordetella, and influenza. So if they're really social, the Bordetella and influenza, and if they're going camping and hiking in heavily wooded areas, the Lyme. After vaccines and heartworm test and prevention, I would say blood work is pretty important. And let me just tell you, this is where some of the nuance comes into play. Yearly blood work is a very useful tool, and it is a lot more important for our elderly babies. So if you have a 13-year-old dog, I personally would almost place blood work more important than core vaccines. And again, that is my opinion, and I think everything that I have mentioned in this list is important, and it just matters that it gets done eventually. But that's all I have time for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 72 of things that your vet staff wishes you knew, and for this video we're going to talk about subtle signs you shouldn't ignore. Pets can be exceptionally good at hiding pain, and they can be very stoic. The main reason for this comes down to survival instinct. So although our pets now are domesticated, some of that instinct is still there, and in the wild, being injured or ill made you a target. Subtle changes matter because a lot of times it's not an acute injury. It's something that's been brewing for a while, and then you finally start to see them do something like limping, and they're like, oh, it just started yesterday. When in reality, it's probably been brewing for a while. It's not always acute. Movement changes are one of the things that we like to keep an eye on. So if your pet isn't jumping like they used to, is slower getting up, hesitates on stairs, or seems very stiff, that's not always just them getting older. It can often mean pain, and that can be things like arthritis or even IVDD. The second thing to keep an eye on is a change in energy levels. So if they are sleeping more, they're less playful, or just seem a little bit off, that's worth paying attention to even when it doesn't seem dramatic. That could be a sign of something like anemia or heart disease. Behavior changes are another thing we take into account. So if your pet suddenly becomes more clingy, more withdrawn, hiding more, or even getting irritable and snapping at you, it might be pain or illness, not necessarily a behavioral concern. Now this one is pretty cat specific, but grooming changes. If their coat starts looking greasy, matted, or unkempt, that could mean they don't feel well enough to groom like they normally would, and you might see this in things like arthritis or even dental disease. And a quick mention, we do also see grooming issues in cats that are severely overweight and can no longer reach those areas. Something else to keep an eye on is a change in appetite. And this goes both ways. Being suddenly ravenous could be a sign of an underlying disease such as Cushing's disease, and not eating slower, leaving a little food behind, or suddenly becoming picky can also be signs that something is wrong, such as in severe dental disease. Posture changes are also something you should look at. Watch how they're sitting and holding themselves. Hunched posture, stiffness, favoring one leg, or just looking tense all can be signs of discomfort, and that could mean something like arthritis, abdominal pain, or even IBDD. I'm almost out of time, so I'm going to quickly mention some other types of changes you could look for. Bathroom and urinary changes, breathing changes, weight changes, and GI changes. Seeing any of these changes in your pet does not mean that you automatically need to freak out. It does mean maybe it's worth going to talk to your vet about it, and best case scenario, they tell you that your pet is fine, they're healthy. That's all I have time for, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 73 of things that your vet staff wishes you knew, and for this video we're finally going to cover something I've been promising for a little while: elbow dysplasia. Elbow dysplasia is a developmental orthopedic condition that affects the elbow joint, most commonly seen in large or giant breed dogs, such as Labrador Retrievers, German Shepherds, Golden Retrievers, Rottweilers, and Bernese Mountain Dogs. The elbow is made up of 3 different bones that all have to fit together perfectly, and when they don't, that's where the problems start. I have this little diagram here to show you for a visual, and if you notice, it's actually the same 3 bones that make up a human's elbow: the radius, the ulna, and the humerus. Without going into too much detail that it bores you, elbow dysplasia happens when pieces break off, don't fuse, or don't fit together correctly, and that will cause pain and damage over time. Symptoms of elbow dysplasia include front leg limping, stiffness, especially after rest, and not wanting to run, jump, or play like they normally would. Diagnosis usually involves physical exam, x-rays, and sometimes more advanced imaging like a CT scan, and that's because early cases don't always show up clearly on x-rays. Treatment depends on severity of the case, so some dogs can be managed with weight control, joint supplements, anti-inflammatories, and controlled exercise. But others may need surgery, especially if there are fragments in the joint. And even with surgery, this is often something we manage, not cure. Long term, these dogs are more at risk for arthritis or even early onset arthritis, which is why early diagnosis and intervention matter so much. I do want to make a quick point right here. So large breed dogs in general are prone to several different orthopedic issues, and part of that has to do with how fast they grow and how much strain is going on their joints. So they're more prone to having arthritis in general, and it's really smart to start joint supplements early. I did cover arthritis in more depth in a whole video on its own back in part 29 if you want to go watch that. There are some things you can try to do to prevent elbow dysplasia. Although it's not foolproof, you can do everything right and your dog can still get elbow dysplasia. So ethical breeding and proper growth in puppies matters a lot here. Overfeeding, rapid growth, and poor genetics can all increase their risk of getting elbow dysplasia. While you may not have much control over the breeding portion of that, there are things you can control, like starting joint supplements early, feeding them a proper diet, and making sure they don't get too overweight. But that's all I have time for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 74 of things that your vet staff wishes you knew, and for this video we're going to talk about something called Wobbler Syndrome. And the technical name for Wobbler Syndrome is CSM, or cervical spondylomyelopathy. Wobbler syndrome is caused by compression of the spinal cord in the neck or the cervical spine, and there are 2 main forms that will cause Wobbler syndrome to happen. The first form is disc-associated, and that's more common in Dobermans. In disc-associated Wobbler syndrome, the intervertebral disc bulges or herniates, compressing the spinal cord. And this is typically found in middle-aged to older dogs, and it can seem like it's more acute than the other option. The second type is bone-associated Wobbler syndrome. This is more common in large or giant breed dogs like Great Danes, Mastiffs, and Weimaraners. In this form, the compression of the spinal cord is caused by malformation or overgrowth of the vertebrae, and this is usually seen in young, rapidly growing dogs. But in simple terms, it happens when either the disc is bulging and pushing up or the bone structures are narrowing the space. And when that happens, nerve signals can't get through like they're supposed to. Early signs might look like sudden hind end wobbling, dragging toes and scuffing nails, slipping on floors, or looking kind of drunk. As it progresses, you're likely going to see more like weakness in all four limbs, difficulty standing, neck pain, or even a wide stance in the hind limbs because they're trying to balance themselves. As it gets advanced, they may be totally unable to walk, and you might start to see muscle atrophy or loss of muscle. I do think it's worth mentioning that hind limbs are usually worse than the front ones at first because those signals have a lot farther to travel down the spinal cord than the front limbs do. Diagnosis usually looks like a neuro exam to localize the problem in the neck. X-rays maybe because they could suggest changes, but they're not definitive, especially in early cases. But the gold standard would be an MRI or a CT because they can actually see the compression on those. Treatment is often either medical management or surgical, depending on severity and if surgery is an option. Medical management usually looks like anti-inflammatories and pain control, as well as activity restriction, and this is used more for mild cases or when surgery is not an option. Surgical treatment removes pressure on the spinal cord and stabilizes the vertebrae. This is used more for moderate to severe cases and progressive symptoms. Surgery is not always a perfect fix for this, but it can significantly improve their quality of life. That's all I have time for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 75 of things that your vet staff wishes you knew, and for this video we're going to talk about the English Cocker Spaniel and things you should know if you have one or plan on getting one. As usual, we're going to start by talking about coat colors and types. So they too come in far too many colors for me to list them all in this video, but just know that there are several, and those big dramatic ears that this picture so lovingly displays is a big feature for them. They typically have a double coat with medium length silky outer coat and an undercoat that helps regulate their temperature. They're known for having feathering on their fur, and the working and field breeds have shorter coats with lighter feathering, while the show lines typically have longer and fuller coats with more dramatic feathering. Since we're still talking about the coat, I do want to mention that this breed, because of that long hair and the feathering, they're very prone to getting matted. And so grooming is very important, but if you do see a mat, do not go at it with scissors. You are very likely to not be able to tell the difference between that mat and their skin and give them a laceration in the process. So either use clippers or go to a professional. They were originally bred in the UK as hunting companions, primarily for fleshing out and retrieving game birds, specifically the Eurasian woodcock, which is where the name cocker comes from. They tend to be between 26 to 34 pounds and live on average between 12 to 14 years. They tend to be highly intelligent and trainable, very people-oriented, very energetic, tend to have a strong prey drive, and are prone to separation anxiety if they are understimulated. Now let's talk about some of the major health concerns that they can be prone to. English Cocker Spaniels can be prone to having hip dysplasia, which I covered back in part 31, and less commonly but can still happen, luxating patella, which I covered back in part 32. They can be prone to obesity if they're not getting enough exercise or you're feeding them too much. They're also more prone to having eye issues, including progressive retinal atrophy, cataracts, and glaucoma. Hypothyroidism, or an underactive thyroid, is also something to keep an eye out for in this breed. They can be prone to having allergies, which I covered back in part 34, and they can also be prone to having chronic ear disease because of those really big ears. And chronic and recurring ear infections can be influenced by having allergies, so they might get them more often if they also have allergies on top of that. I did cover ear issues in quite a bit of depth back in parts 35 through 37 if you want to go back and watch that. And I do quickly want to bring up one more thing, and that is rage syndrome. So although it is rare overall, we do see more prevalence in Cocker Spaniels, both English and American. I may do an entire video on this, but in short, it causes sudden onset of aggression with no clear trigger. But that's all I have time for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 76 of things that your vet staff wishes you knew, and for this video we're going to talk about American Cocker Spaniels and things you should know if you have one or plan on getting one. As usual, we're going to start with a picture and talking about coat types and colors. So there are far too many colors for me to list them all in this video, but they do come with a medium to long length double coat that has a silky and soft texture and can be flat or slightly wavy with lots of feathering. The American Cocker Spaniel actually has even more grooming needs than the English Cocker Spaniel does. So they are very prone to getting mats in their hair. Grooming is very important for them, but if you do see a mat, do not cut it with scissors. You are likely to not be able to tell the difference between that mat and their skin, and you could cut them and hurt them in the process. Please go to a professional or use clippers. American Cocker Spaniels came from the same hunting spaniel roots as the English Cocker Spaniel, but the split happened when United States breeding started favoring smaller, more compact dogs with heavier coats. They became more of a companion and show-focused breed, while the English Cocker Spaniels stayed more field-oriented. They typically grow to be between 20 to 30 pounds and on average live between 10 to 14 years. They tend to be extremely sweet, eager to please, affectionate, and people-oriented. They are often described as Velcro dogs, and they can be prone to anxiety if they are poorly socialized. Now let's talk about some of the major health concerns you need to look out for this breed. If you watched my last video on English Cocker Spaniels, there's going to be a good bit of overlap because they are very similar and they do have the same roots, but there's some minor differences for American Cocker Spaniels. They can be very prone to having eye issues, even more so than the English Cocker Spaniel, and that could include cataracts, glaucoma, or progressive retinal atrophy. Luxating patella is another thing you need to keep an eye on for this breed, and I did cover this in more depth back in part 32. They can be prone to having heart disease, including DCM or dilated cardiomyopathy. They can also be prone to having allergies, which I covered back in part 34, as well as chronic ear disease and infections, which I covered in quite a bit of depth back in parts 35 through 37. The main reason they're so prone to having chronic ear disease and infections is because of those big floppy ears with lots of hair. But I do want to mention that allergies play a role in ear infections, so if they have allergies on top of that, then they're more likely to have more ear infections than they would already be prone to. And the last major health concern I want to bring up for this breed is rage syndrome. So although it is rare overall, we do see more prevalence in Cocker Spaniels, both American and English. I do plan to do a future video on this in depth, but in short, it does cause sudden aggression with no clear trigger. That's all I have time for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 77 of things that your vet staff wishes you knew, and for this video, we're going to talk about wobbly cats. By now, a lot of people have seen the cute little videos of the wobbly cats online, but we're going to talk about what actually causes that. The technical name for it is cerebellar hypoplasia, which basically means underdevelopment of the cerebellum, and that is the balance and coordination center of the brain. It is most commonly caused by exposure to Feline Leukemia Virus, or also known as feline distemper, while still in the womb or in very early on newborn kittens. It's going to be significantly more common in unvaccinated populations. And feline distemper attacks rapidly dividing cells, and in cases of wobbly cats, damaging the cerebellum, leading to permanent brain damage. By the time you're seeing them, they are likely no longer infected with feline panleukopenia. So what you're seeing is just the aftermath of the damage it did. The severity can range quite a bit, anything from a hardly noticeable wobble to falling really frequently and probably needing adjustments and care. Most of these cats actually live pretty normal, long, healthy lives. Cerebellar hypoplasia is not progressive, contagious, or painful. They're not suffering just because they wobble. Now they can be more prone to injury, so that just means their care needs a little adjustment. Now let's talk about what that care might look like if you do decide to bring one of these babies into your family. First, you should keep them as an indoor-only cat. Going outside with those types of coordination issues can become a safety risk really fast. Second, you can get them some low-entry litter boxes so that they're not having to step up so high and can use the bathroom easier. Third is getting them some extra wide and shallow food and water bowls. They can be kind of messy when they're eating, And if they get excited about their food, they are likely to wobble a little bit more. So that's one way you can reduce mess and make it easier on them to eat and drink. You're also going to want to avoid letting them on high surfaces or providing ramps and stairs if they are coordinated enough to handle that. Something else you can do is provide them a lot of non-slip surfaces, and that could mean just adding rugs and mats for them. In some cases, you might want to put padding on sharp corners and walls to keep them from bumping into them so hard. And you're not limited to just what I suggested. A lot of these cats are loved to the point of invention, and I'm sure you can find some pretty good ideas out there. But that's all I'm going to cover on Wobbly Cats, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 78 of things that your vet staff wishes you knew, and for this video we're going to talk about Feline Leukemia Virus, or also known as FELV. FELV is a virus that affects cats and attacks their immune systems. It spreads through close contact, like grooming, sharing food and water bowls, bite wounds, and even from mother to kitten. And despite the name, this isn't just cancer. This is actually a virus that can lead to anemia, chronic infections, and yes, even cancers like leukemia and lymphoma. It does get a little nuanced because not every cat that is exposed to it has the same outcome. FELV infection could be abortive, regressive, or progressive. Abortive infections are the best case because they mean the cat's immune system completely clears the virus. Regressive or latent infections are when the virus is controlled but still hides in the body. These cats might still test negative for it on some tests, but are still carrying it. Then it can reactivate later, especially with stress or illness. Progressive infections mean the virus is actively replicating and the cat is contagious and will eventually get sick. Prognosis for progressive infections can look like 2 to 3 years after diagnosis, but it's not the virus itself that causes them to pass. It's the complications like cancer and severe infections. We can test for FELV with a simple blood test in clinic, but that test only tells us if the virus is active in the bloodstream at that moment. So sometimes retesting later or additional testing is needed. There is no cure for FELV, but that does not mean that we're completely helpless. Treatment is focused on supportive care like managing infections and keeping them comfortable. There is a preventative vaccine for FELV that is considered a lifestyle vaccine if your pet is indoor and outdoor. Because it spreads so easily between cats, it is generally not recommended to keep FELV positive cats with FELV negative cats. That doesn't mean it's impossible, but generally not recommended. And the same applies even if your cat is vaccinated for FELV, because there is no vaccine that gives you a 100% guarantee that your pet will never get infected. And that's a big reason why testing before introducing a new cat to your home is so important. FELV is serious, but it's not always an immediate death sentence, and understanding it can make a huge difference in your cat's life. But I believe that's everything I wanted to cover on Feline Leukemia Virus, so please let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 79 of things that your vet staff wishes you knew, and for this video we're going to talk about AHDS, or Acute Hemorrhagic Diarrhea Syndrome. I do want to mention that this may also be referred to as HGE, Hemorrhagic Gastroenteritis, although the AHDS is the more current and more accurate term. AHDS is a condition where dogs develop sudden, severe vomiting and bloody diarrhea, and they can become dangerously dehydrated in a matter of hours. Often the diarrhea is described as strawberry jam-like, but the important thing to take away here is that this is not just normal stomach upset and doesn't usually resolve on its own. I also want to mention that this condition primarily affects dogs. Cats can get bloody diarrhea too, but it's typically something else causing it. We don't have one exact clear cause for it, but it is strongly linked to an overgrowth of bacteria called Clostridium perfringens, which can release toxins into the gut. Triggers for it can include stress, sudden diet changes, or getting into something they shouldn't, but it can also happen without a clear trigger. I feel like it's worth mentioning that it is more common in smaller breed dogs like Yorkies and mini Schnauzers, but it can happen to any dog. Symptoms may look like lethargy, vomiting, not wanting to eat, and then that very sudden, very bloody diarrhea. When I say sudden, I mean your dog can be completely fine that morning and very sick by the afternoon. There is not a single test to diagnose it, so often it is based on the history and symptoms, ruling out things like parvovirus and parasites, and blood work that shows a very high packed cell volume due to the dehydration. Treatment involves aggressive IV fluids, anti-nausea meds, GI protectants, and sometimes even antibiotics, which could be a little controversial and depends on the case. Prognosis is great with treatment, with most dogs improving within 24 to 72 hours after onset. But without treatment, this can be fatal. I do want to discuss a little bit of the nuance to having bloody diarrhea. So just a little bit of blood, maybe at the tail end or maybe spread throughout, maybe mucousy, does not scream alarm bells the same way as having just straight strawberry jam. It's not great. You shouldn't wait to get your pet care if they are having diarrhea like that consistently. But it could mean the difference between probiotics and a bland diet versus hospitalization. But that is everything I want to cover on acute hemorrhagic diarrhea syndrome. So please let me know if you have any questions or suggestions on what else you want me to cover. Love you guys. Bye. Welcome back. This is part 80 of things that your vet staff wishes you knew. And for this video, we're going to talk about pancreatitis. I do feel like this is an important video to make because it seems like pancreatitis is frequently misunderstood. Even if you just look at the term pancreatitis, that means inflammation of the pancreas, but it goes much deeper than that. To fully understand it, you first need to know what the function of the pancreas is. The pancreas has two very important jobs. First, it produces digestive enzymes that help break down fat, protein, and carbohydrates. And second, it produces insulin, which helps regulate blood sugar. So naturally, when something goes wrong with the pancreas, you are going to see issues in both of those jobs it's supposed to perform. First, let's talk about those digestive enzymes. So they are supposed to stay inactive until they reach the intestines, but with pancreatitis, they activate too early and start to damage and digest the pancreas itself. And yes, that is as painful as it sounds. If enough damage is done, it can lead to a long-term complication called EPI, or exocrine pancreatic insufficiency. And that is when the pancreas stops producing enough digestive enzymes after damage. Now let's talk about the insulin portion of that. So insulin helps move glucose from the bloodstream into the cells to be used for energy. And when the pancreas becomes inflamed, those insulin-producing cells can get damaged too and affect blood sugar regulation. And just like with digestive enzymes, the effects can be short-term or long-term. Stress and inflammation alone can raise glucose levels during illness, but if enough damage is done to those insulin-producing cells, the body may not be able to make enough insulin anymore, leading to diabetes. Symptoms in dogs might look like vomiting, diarrhea, not wanting to eat, lethargy, and abdominal pain. Cats, meanwhile, like to make things a little bit more difficult for us, so their symptoms might look like hiding more, seeming tired, losing weight, or just not acting like themselves. And you might see vomiting or diarrhea, but it's not always the case. As far as triggers go, for dogs, the biggest one is high-fat foods, and that might mean some table scraps and some greasy foods, but even some high-fat dog foods can make this happen, even if the dog has never had a table scrap a day in their lives. Triggers in cats can be a little bit more complicated because their pancreatitis is less often associated with fatty foods and more often associated with underlying disease and inflammation involving other organs like the intestines and liver. I want to make one last point before wrapping this up. Pancreatitis is not a one-size-fits-all. It is different between species and it is different from pet to pet. Some pets can eat high-fat foods and not have a single problem with it, while some can have a single fatty meal and that will send them to the hospital. But my point is, if something seems off, go get it checked out. And that's everything I wanted to cover on pancreatitis, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye.